All right, so you're here because you want to know more about managing glaucoma, right? And I bet you're especially curious about what's out there besides the usual eye drops.
Yeah, I bet a lot of folks are wondering about that.
Well, we're diving deep into all sorts of sources for you. We've got medical articles, we've got those alternative health websites, and we even have some keyword lists to give us a peek into what people are really searching for.
Well, those keyword lists, they can be really interesting. They really show what's on people's minds.
Definitely. And honestly, we found some pretty unexpected connections, things you wouldn't normally think about with eye health, like fasting.
Fasting, okay?
Yeah, and honey even.
Huh.
I know, right? But there's some seriously cool stuff in here.
Right, I'm intrigued. But before we get too far into the really out there stuff, maybe we should make sure everyone's on the same page. So, glaucoma. Most people probably know the basics, that it's called the silent thief of sight, because it can really sneak up on you.
Right, no noticeable symptoms at first, which is why those regular eye exams are so important.
Absolutely.
But okay, say you've been diagnosed. What happens then? Besides the eye drops, what else is out there?
Well, there are a few things doctors are going to consider. For example, is it open-angle glaucoma or angle closure glaucoma?
Ah, yeah, different types.
Exactly, because that's going to help determine the best way to treat it. And they'll probably do a visual field test, too.
Oh, yeah, to map out your vision.
Yeah, to see if there are any blind spots and how much damage there might be. It helps figure out how far along things are.
So it's kind of like a personalized roadmap for each patient.
You got it. Now, you mentioned eye drops earlier, and those are usually the first line of defense. They work in a couple of different ways. Some, like timolol, are beta blockers.
Timolol, yeah, I've heard of that one.
Yeah, and they basically reduce how much fluid your eye produces.
Hmm.
Then there are prostaglandins, which work by helping the fluid drain better.
Okay, so both ways are aiming to lower that pressure inside the eye.
Exactly, because that pressure is usually what's causing the damage in glaucoma.
Makes sense. But what happens when the eye drops aren't enough?
Well, then we might look at laser treatments or even surgery. But those are usually for cases that are further along.
Got it. So we've covered the traditional medical approaches, but now I want to get to these alternative therapies because that's where things get really interesting. Fasting. It kept coming up in our research. What's the connection there?
Okay, so fasting, it actually triggers a process called autophagy. Think of it like spring cleaning for your body.
Spring cleaning, huh?
Yeah, your cells start breaking down and getting rid of all the damaged parts. And that happens in your eyes too. And those damaged cells, well, they can lead to inflammation and something called oxidative stress.
Oxidative stress, I've heard that's not good.
Definitely not. And we know that those things are connected to eye diseases that come with age.
Oh, interesting. So fasting could help protect against those?
There's some evidence pointing in that direction, yeah.
Yeah.
And with glaucoma specifically, there have actually been studies showing that patients who fasted saw their eye pressure go down.
Really? That's pretty amazing. But are there any downsides to fasting, especially if you're worried about your eyes?
That's a really good point. You have to be careful about staying hydrated.
Ah.
Yeah, when you're fasting, you're often taking in less fluids overall, and that can lead to dry eyes, maybe some blurry vision too.
Oh, that makes sense.
So it's super important to drink plenty of water and maybe even use those lubricating eye drops if you need them. And of course, before making any big diet changes, talk to your doctor first. Always a good idea.
Definitely good advice. Okay, so fasting is one interesting possibility, but then there's another one that really surprised me, and that's honey.
Honey.
Honey. It kept popping up in our research.
Well, honey does have some amazing properties. It's anti-inflammatory, it's antimicrobial, and it's really soothing, which, surprisingly, makes it pretty effective for a bunch of different eye conditions.
Wait a minute, are we talking about putting honey in your eyes?
Not straight from the bear, no.
Yeah.
You have to use honey that's sterilized and medical grade.
Okay, that makes more sense.
Manuka honey is a popular choice, and you can actually get it as eye drops. But again, super important, talk to your eye doctor before you put anything in your eyes.
Definitely. Safety first.
Yeah, right.
So we've got these traditional treatments, the eye drops, the lasers, and then we have these kind of alternative options like fasting and honey. Where do you see all of this fitting into the bigger picture of how we manage glaucoma?
Well, that's what makes this whole deep dive so interesting. The conventional treatments, they're still the gold standard. But what we're seeing more and more is that these alternative therapies, they might actually offer some extra benefits. It's possible they could work alongside the traditional approaches.
So it's more of a holistic approach, like you're addressing the root cause, but also trying to support the overall health of your eyes.
Exactly, and that's where those keyword lists come in. We saw people searching for things like vitality, anti-inflammatory, It seems like people want to know how to not just manage the glaucoma, but actually improve the health of their eyes.
So it's not just about preventing further damage, it's about actively trying to make your eyes healthier.
Exactly.
But I know that treatment for glaucoma, it can't reverse the damage that's already been done, right? Like if there's vision loss, that's permanent.
Unfortunately, yeah, you're right. Damage to the optic nerve, it's irreversible.
That's tough.
It is. But the good news is that with the right management, we can often slow down the progression of the disease, maybe even stop it completely. That's why catching it early and sticking with your treatment plan is so important.
So it's kind of a race against time then.
In a way, yeah. But it's also about giving people the information and the tools they need to take control of their eye health. It's not about just accepting a diagnosis. It's about being an active participant in your own care.
I like that. It's about being proactive, taking charge of your health.
Absolutely.
But before we go too far down that road, there's one more thing I wanted to touch on. We were talking about the different types of glaucoma. I know there's open angle and angle closure, but are there other types?
Yeah, those are the two most common ones for sure. Open angle, that develops more gradually over time. And then angle closure, which comes on suddenly. That one you need to get to a doctor right away. But there's also something called normal tension glaucoma, where the pressure in the eye is actually normal, but the optic nerve is still being damaged.
Mm.
And then there are types that affect children and some that are secondary, meaning they develop because of another health condition.
So it's not just do you have glaucoma, but what kind do you have?
Right, exactly.
That must make treatment even more personalized.
It definitely does. And that's why a really thorough eye exam is so important. Because it's not just about checking the pressure. It's about looking at the structure of the optic nerve, and that drainage angle we were talking about before.
And speaking of individualized treatments, we saw some interesting stuff about stem cells in our research. I know stem cells have a lot of potential in other areas of medicine, but are they being looked at for glaucoma too?
They are. It's still early days, but researchers are exploring ways to use them to repair damage to the optic nerve. The idea is to actually regenerate those damaged cells, which could potentially restore vision that's been lost.
Wow, that would be incredible. How close are we to that actually happening, though?
Well, it's a very active area of research, but we need to be realistic. Stem cell therapy for things like glaucoma, it's still experimental. There's some big hurdles to overcome before it's something that's widely available, but the potential is definitely there, and the research is moving pretty quickly.
Fingers crossed for some breakthroughs there.
Okay.
Okay, let's shift gears a bit. You mentioned those keyword lists before. What other kinds of things were people searching for when it came to glaucoma?
Well, aside from the things you'd expect, like medicine, increased IOP,
Right.
there were a lot of searches that focused on the overall health of the eyes. It seems like people want to know how to not just manage the glaucoma, but how to make their eyes healthier in general.
Yeah, that makes sense. It's not just about slowing down the damage, it's about taking a more proactive approach. Which brings us back to honey, actually.
Sunny?
Yeah.
Uh,
We saw keywords like anti-inflammatory, antimicrobial, and soothing, and a lot of those were appearing alongside searches for honey. It seems like people are realizing it might be helpful not just for things like dry eyes, but maybe for overall eye health.
It is really interesting how honey keeps coming up.
It's like that saying, an ounce of prevention is worth a pound of cure. But in this case, maybe it's a teaspoon of honey.
Maybe. But in all seriousness, there's actually scientific evidence to back up honey's effectiveness.
Mm.
It's well documented that it has anti-inflammatory and antimicrobial properties, and there's more and more evidence suggesting it could play a role in managing and maybe even preventing eye conditions.
Okay, so honey gets a thumbs up. But with all these different options out there, the traditional treatments, the alternative therapies, the new research that's happening all the time,
Yeah.
it can feel pretty overwhelming trying to figure out how to manage glaucoma.
You're right. There is a lot of information out there, and it can be confusing. That's why it's so important to have open and honest conversations with your eye doctor. They can help you weigh the pros and cons of each approach and figure out what makes the most sense for you based on your individual needs and preferences.
So it's about finding that balance between the medical treatments that have been around for a while and exploring these additional options that might be able to give your eye health an extra boost.
Exactly. And remember, knowledge is power. The more you understand about glaucoma and all the different ways to manage it, the more equipped you'll be to make good decisions about your eye care.
I couldn't agree more. We've uncovered some really fascinating insights today, things I never would have connected to glaucoma before.
It just goes to show there's always more to learn. and medicine is constantly changing and evolving.
It's actually pretty inspiring. It makes me want to be more proactive about my own eye health.
Me too. It's a good reminder that we have more control over our health than we think.
And speaking of control, we've talked a lot about the medical side of things, but what about the individual's role in managing their glaucoma?
That's a great point. It's not just about treatments and procedures. Lifestyle choices play a big role too.
Okay, so let's talk about that. What kinds of lifestyle changes can people make to support their eye health?
One that comes up a lot is diet. What you eat can have a huge impact on your overall health, including your eyes. A balanced diet that's rich in antioxidants and nutrients, that's what you want to aim for.
So lots of fruits and veggies.
Exactly. Leafy greens, those colorful fruits, foods that are high in omega-3 fatty acids. Those are all good for your eyes.
What about exercise? Does that affect eye health?
It does. Regular exercise, it can improve blood flow to your eyes, and it can help regulate that pressure we were talking about before.
Interesting. So we've got diet, exercise, anything else?
Stress management is a big one. Chronic stress, it can contribute to so many health problems, including eye problems. So finding healthy ways to manage stress, whether it's meditation, yoga, being out in nature, whatever works for you, it's going to benefit your overall well-being and your eye health too.
It all comes back to that holistic approach, doesn't it? It's not just about treating the symptoms, it's about taking care of yourself as a whole person.
Exactly. And that includes protecting your eyes from the sun. Make sure you're wearing sunglasses that block UV rays, especially if you're spending a lot of time outdoors.
This has been so eye-opening. I feel like I have a totally new perspective on glaucoma.
I'm glad to hear that. It really is about empowering yourself with knowledge and becoming an active participant in your eye health.
And speaking of knowledge, there was one more thing from our research that I wanted to explore. So those keyword searches. One that really caught my eye was increased stem cells. It's a bit vague, I know, but it makes you think about some pretty interesting possibilities.
It definitely does. We were talking earlier about how stem cell therapy is being explored to repair the optic nerve.
Right.
Well, that's still in the experimental phase. But there's actually some new research suggesting that certain lifestyle factors could actually influence stem cell activity in the eye.
Oh, wow. So not a direct treatment yet, but maybe a way to kind of boost your body's own natural repair mechanisms.
Exactly. It goes back to that holistic approach we were talking about. It's not just about treating the disease itself. It's about creating an environment within your body that supports the overall health of your eyes.
And maybe those lifestyle changes we talked about, like diet and exercise and stress management, could actually play a role in that.
That's a real possibility. We're still learning a lot about how lifestyle choices affect things like stem cell activity, but it's definitely a fascinating area of research. It holds a lot of promise for the future of eye health.
I love that we're ending on such a hopeful note. We've gone from the basics of glaucoma all the way to the cutting edge of research. It really feels like there's a shift happening in how we approach this condition.
I think you're right. It's not just about managing symptoms anymore. It's about giving people the power to take control of their own eye health.
And realizing that there are so many factors involved. It's the medical treatments, yeah, but it's also about the choices we make every day. It's the new research that's coming out all the time. It's even things like honey, which we never would have thought of before.
It's about looking at the whole picture, understanding how all the pieces fit together, and then using that knowledge to make smart decisions that work for you and your individual needs.
Well said. So as we wrap things up here, is there one key takeaway you want our listeners to walk away with?
If I had to choose just one, it would be this. Be proactive about your eye health. Don't wait until you start having problems. Get those regular eye exams, have those open and honest conversations with your eye doctor, and don't be afraid to explore all the options that are out there. Knowledge is power, and when it comes to your vision, you have the power to protect it.
I love that. Such a powerful message. And it makes me wonder, could lifestyle choices play an even bigger role in eye health than we realize?
That's a great question. We've seen how things like fasting and honey can have a real impact. It makes you stop and think, what other lifestyle factors might be influencing our eye health? And how can we use that knowledge to protect and improve our vision?
It's like an invitation to take a closer look at our habits, and see if the choices we're making are actually supporting our eye health. Well, on that note, I think we've reached the end of our deep dive.
Yeah, I think so.
I hope you found it as interesting as I did. I know I learned a lot.
Me too. Always a pleasure chatting with you about this stuff.
And to all our listeners out there, thanks for joining us on this journey. If you have any thoughts or questions, we'd love to hear from you. Until next time, keep those deep dives coming.